guys, we're going to do a frog stretch today. So the frog stretch, we're going to bias this into internal rotation so it works on your hips. So you're going to feel this into the capsules as well as a lot of the soft tissue around there. Capsules, that's just that deepest structure. It's also soft tissue. So what I want you guys to do is we're going to set up in, I'm going to show you front on so you can see, and then I'm going to show from the side so you can see how I sit back. So we're going to set up in our end range of abduction, which is a stretch on our groin. So we're going to go all the way out there. If you need to, just go slowly and take your time out there. Then I'm going to go show you from the side. Then what we're going to do, so we're here, we're going to go to our end range. We're going to actually bring our foot out so we're at 90 degrees, right? So I'm going to get into this frog stretch. I want my knees out, so if you need to lift your foot, bring it out. And we're into this position. I'm going to go down into onto my shoulders here, and then you're going to sit back. So I'm going to sit back. Now, what I feel when I sit back is all around this hip joint. This exercise is working all of your hip. It's working internal rotation. If this is too much, bring the feet closer and just don't sit so far back. You can also stay up here on your arms, absolutely, right? Wherever's comfortable for you. So I'm gonna sit down here, and what I want you to do is you're going to sit here for 2 full minutes. So we're gonna hang out, breathe, and relax into that stretch, thinking about getting this tissue on the inside to relax. All of our tissue really should nice and relax, and breathing in there. Again, if this is too much, back off and shorten that range to what you guys can handle, right? So we're going to hang out here, breathing in and out. Breathing in and out. Right, again, we're doing 2 full minutes here. We're sitting back to what's comfortable for us, right? Holding and breathing, nice and easy. You calm your nervous system. Think of a little meditation, or do your calming breath. So let's do a few rounds of our calming breath. We're going to take a breath in on 4. And then hold for 7. And breathe out on 8. You'll find your body relaxes more and sinks further. So we're going to do a few rounds of that. I'll count you through. So in on 4, 3, 2, 1. Hold for 7, 6, 5, 4, 3, 2, 1. Out on 8, 7, 6, 5, 4, 3, 2, 1. In on 4, 3, 2, 1. Out on, hold on 7, 5, 4, 3, 2, 1. Out on 8, 7, 6, 5, 4, 3, 2, 1. Now count yourself. In on 4. Hold for 7. Out on 8. Right, till we hit that 2-minute mark. We're going to do our PAILs now to gain range here. What I want you to do, stay exactly where you are. You're going to start from the knee, from the hip. We're going to start the contraction from here. We're trying to bring our legs in. The floor will stop us. I do not want motion. So this is an isometric contraction. So we're going to start from the hip. So I'm going to start from those adductors, and I'm going to start to push into the ground. Don't let yourself come up. Hold. Ramping up 20, 40, we're going on a percentage here, 60%, 80%, 100%, everything you got into the floor, tensing and radiating through your whole body. Hold. 5, 4, 3, 2, 1. Rails, which is the knees are kind of push away. Right away, you're contracting away, doing the opposite. So all this tissue is trying to go out and away. Hold. 5, 4, 3, 2, 1. breathe, let your tissue sink. Now, you can do a few sets here where you're actually gonna then push a little bit back, knees out, hips back, and you'll really feel that through the front of those hips and those adductors. Then you can do another couple rounds there where you're contracting in for 10 seconds, ramp it up and then hold for 10, and then contract out for 10 seconds. That is a frog. It'll take a bit to come out of that. Even me, I've done this one a little bit and it still is hard, right? It's really, this is something I would tell you to do only a few times a week. If you do it right, you will then feel this start to gain range, right? 2-minute passive hold, contract the tissues inwards. So start from the hips, radiate that tension out to the knees and pull in. Then we're gonna ramp that up to our 100% and we're gonna do tap for 10 seconds. Then we're gonna do rails right away 100%, which is contract from here, pushing out. So you're thinking about the knees are trying to go out. Hold that for 10 seconds. Breathe, let your body sink. So sink further down, sink further back, letting those hips stretch all the way through. Relax that. Second round, you can hold for about a minute. Then you do your contractions. You can do up to 3-4 rounds, depending on what your tissues can handle. Remember, this is hard on all this tissue. So start with just 1 or 2. And then if you're not too sore, you can do more the next time, okay? This is opening up those hips and internal rotation bias, as well as stretching those adductors on the inside. Take care.